We're back. As I said before that short break, we're talking heart disease, and our guest is Dr. Stan Odell. He is of Health RS Clinic. Good morning.
Good morning to you.
I get to say Happy New Year. I haven't seen you all year.
I know.
So, good to see you again. What do you have to tell us today? Yes.
Heart disease. February is a month where people lose their heart. I'm here this morning in a few minutes to show folks how they can save their heart. And actually, in December, I was on vacation in Manila in the Philippines. I was introduced to a gentleman by the name of Dr. Ed Cabantoc, a medical doctor by profession. And it turned out that he saw the light on the other side of the fence, I like to put it, and walked away from a very lucrative, thriving medical practice to establish a nutritional company. This company is called Alliance in Motion Global, and it focused on, as I said, powerful nutritionals. What I should tell you, and the reason why I'm giving this snippet first, is that in August of 2013, long before I bumped into this gentleman, I made a decision to focus on cardiovascular challenges among our youth. Why? 2 to 3 weeks earlier than the August date, I had about 3 patients that came into the practice with extremely high blood pressure scores. 190 over 80, 201 over 95. I recall those two BPs.
Young?
Under 22 years of age.
Now, what on earth could have caused that?
Well, diet and lifestyle. So, to show where Dr. Cabantoc fits in this picture, and I like to say this is divine intervention, nothing less. I don't believe in happenstance. Things happen for a reason. I truly believe that. But on August 13th, I bought another device. Remember, I said at the beginning, for the last 7-8 years, we've been doing cardiovascular screenings at Health RS Clinic with a different device. I bought August 13th, a new device, state-of-the-art, FDA-approved, Class 2 medical device to do cardiovascular screenings. How was I to know, going on vacation halfway around the world, and by chance, more than chance, to be introduced to a gentleman who turns out to be a medical doctor, who is now into nutrition, and he is using that same device to do cardiovascular screenings, and of course some of the products his company offer address cardiovascular challenges. I was given the test. He said, "Hey doc, you got to have this test." So I did the test December 19th, but we'll tell you more about the test late in the story. I want to just focus a little bit on the heart disease, the challenges it raises, and perhaps look at some statistics. Sorry.
Okay, so let's start with, you brought some information to share with us.
Yes.
In terms of heart disease. It's still the #1 killer worldwide.
Absolutely.
Can we look at some of the factors that contribute to heart disease being this #1 killer?
Well, some of the risk factors would be things like obesity. We use a technical term called BMI, body mass index, but basically all a person would need to consider is your waist measurement. And there are values for that given the person's height and gender, a waist measurement. So if you have what we say a big belly, big waist, you are at greater risk of coming down with a cardiovascular event, falling prey to a cardiovascular event, than someone who is a little bit slimmer. Lack of exercise, of course smoking, poor diet, and this is really where naturopathic doctors and nutritionists and people interested in nutrition as a way to turn a chronic acute health situation around focuses. We focus on what you eat, because everything you put into this mouth either would make good blood or bad blood.
Ah, interesting.
Okay. But just 1 second. It's important to know, and maybe we can get the cameras to focus on the banner for a second. Heart disease killed 1 in every 4, 1 in every 5 persons in America.
Okay, so we're getting some stats now, more stats.
You would think this is perhaps a first world problem, but right here in Barbados and the wider Caribbean, heart disease is still the #1 killer, followed closely, of course, by cancer, and of course, Barbados being the diabetic capital, perhaps diabetes is #3 on the list of bad boys.
Interestingly enough, all 3 of these diseases seem to be linked in some form or fashion.
They're cousins. I call them cousins. You have one, you're likely to get one of the other 2. You have 2 of the 3, you're certainly, definitely, almost impossible for you to avoid having the other guy.
Okay, let's take a look at our banner here. Now, there's certain facts that we need to know, and you mentioned the statistics. So share with us a little bit, because I'm getting a little shine.
Yeah, in the U.S. right now, and these are figures, by the way, ladies, that's been taken from the CBC in Atlanta, Georgia, Center for Disease Control. Their most recent figures show that well over 600,000 persons die of heart disease in the United States every single year. That's a quarter of the population. 1 in every 4 persons will succumb to that. Each year, 715,000 Americans have a heart attack. So there's a difference between dying of heart disease and having a heart attack. The greater number seem to succumb to a cardiovascular event. Yeah, okay. And those are huge figures. That's maybe, I don't know, maybe 20 jumbo jets crashing into a building or crashing period every single day. And if that happened in real life, we would pay perhaps greater or closer attention to those numbers. Okay. This is why we're saying we need to stop. And you see, all of this affects the economy. You're talking economics just now. But if a person, with what little savings they have to shell out a whole bunch of cash on a medical problem, whereas more preventatively or ounce of prevention worth a pound of cure, if they perhaps had paid closer attention to their diet over time, they wouldn't have arrived at that destination.
Okay, so how important then is early detection, and what can you tell us about more about some of the risk factors if we haven't touched on some?
Great question. And folks that have seen me here on this program before know that as a naturopathic doctor, I focus. This is why I have a lot of gadgets. It's like going to a mechanic with lots of tools so you can test, what's going on. But early detection is important because it gives the patient, the client, a heads up as to what is happening with your health, in this case from a cardiovascular standpoint, so you can then address the issues. Is it cholesterol? Is it arterial clogging? What is it? Yes. And all of this, early detection can give us a heads up on. What I like to draw patients' attention to is the preventative strategies. Lifestyle and dietary change is certainly top of that list. What we eat, what we drink. We have to remove from our diets the white bread, the sodas, carbonated beverages, broadly speaking, trans fats. When we say white bread, we also need to, for my friends in Asia, we also need to add white rice, high complex carbohydrates of this sort, which breaks down to sugars, isn't going to do the body very, very, very much help. The treatment options, some of the treatment options that are available today in medicine would of course be bypass surgery, angioplasty and so on, but these are expensive options, and I'm saying let's educate the population to take care of their health so you don't have a cardiovascular event. And because of stressors, nutritional, emotional, and physical. Now we have mental stress because of job layoffs and people having that issue to deal with now, particularly in this country of recent. Heart disease can become a major, major problem. What I'd like to, how many minutes do I have? I need to show my results.
You have 1 minute.
1 minute. Okay. Dr. Ed would like this because this is the result sheet, and the bottom line I'm showing here is a type 3. On this cardiovascular screening. And I was that old. I'm not going to say the number. I was that old on the 19th of December when this test was done. 3 weeks later, having done on the products, This is one of them.
Let me just.
Okay, these are a couple of the products we were on. Dr. Ed said, come back and take the test. And what we did, we took the test 3 weeks 3 weeks later, and boom, I went from a type 3 to a type 1. Then, of course, on the 1st of January is my birthday, so now I turned 63.
Make sure you turn it so
Did
that
I
we
say
can
that number?
actually see.
Okay,
Yes.
right. So the important thing is here, what is a type 3? Type 3 arterial health condition, that score, that cardio score depicts the cardiovascular health of a 40 to 50-year-old guy. Now you may say that's not too bad because I'm 20 years older than that range. But 3 weeks later, having taken some of these products, I went to a type 1 test being done on the 13th of January 2014. Type 1, this is the cardiovascular health of a 20 to 30-year-old. And Dr. Ed Kabunto, right there in Manila in the Philippines.
So you're much younger than you actually are, is what you're saying to us because of this?
My arterial system, my arterial system is that of a 20-year-old guy.
Right.
And I have the standing power. Forget my name is Stan, but standing power in all directions, which is important when you're dealing with circulatory challenges. Yes or no,
yes,
ladies?
It's true.
Yes or no? Okay.
If you're following him, gentlemen.
There you go, guys. There you go. So problems do come up, and I'm saying they can be addressed. And as folks know, and in closing, maybe we can wrap this up by saying our consultations are free. They've always been free, and they will continue to be free. In these days, in this day, we're stressing quite a bit. We need to have information, and the consultations are free. Give us a call. We're looking for people who are also interested in doing some of the screenings. And what I wanted to show
what is the treatment called, though? Where you would you mentioned
it's a cardiovascular scan, and this is the device, as opposed to the huge machine that I had 7 years ago to do the same thing. This is it. It's state-of-the-art cardiovascular screening. It's a Class 2, FDA-approved Class 2 medical device. Very, very powerful diagnostics. It spits out. You get a printed report. So I'm looking for folks who may be interested in...
What does it do exactly? Because the last time I had something like that, I was checking my pulse and blood pressure and things like that.
This does all of that and more and more and more.
Okay.
Right. It looks at heart rate variability. It does a stress analysis. It does an arterial health analysis, and it actually tells you the age of your arteries.
Wow.
How clogged it is. And that is huge as a preventative early diagnostic tool to have in operation. So
that little thing could say how much butter I ate.
There you go.
That's
how much
what I was
ice cream
thinking.
you ate last night after dinner.
Oh my! I'm starting to feel guilty already.
We're looking for people.
We need to have you back once again.
Not a problem. Not a problem. My contact numbers, please. My email address, contact numbers. My cell. I'll give the cell directly. Is 246 is the area code, of course, for Barbados. The number is 253-5858. That's 253-5858. Call after the program. My email address, I'll be happy to have you email me to answer questions. It's myhealthdoctor@yahoo.com. That's myhealthdoctor@yahoo.com.
Great stuff.
Thank you so much. Don't lose your heart this year. Get it back.
I like that. I like that one. I'm going to make sure I keep mine really, really close. Well, one area that's close to my heart is traffic, and in terms of how we use our roads. We've been talking about it. So when we come back, we're going to be getting on the road with Junior Jordan. All this and more coming your way.